Think about the last time your car's dashboard lit up with a check engine light. You didn't ignore it, right? You knew something underneath the hood needed immediate attention. Well, your body has its own dashboard, and it's your skin, spanning nearly 20 square feet and making up about 16% of your entire body weight. Your skin is your largest and most visible organ. But it's so much more than just a protective wrapper. It's a highly sophisticated, real-time diagnostic screen. When your internal organs encounter trouble, whether it's a spike in blood sugar, a struggling liver, an overactive immune system, or a nutritional deficit, they often can't signal you with internal pain right away. Instead, they send a distress flare directly to the surface. Today, we're decoding those flares. We're going to look at the exact colors, textures, rashes, and spots your skin uses to say, "Hey, look under the hood, something is wrong." Let's start with changes in how your skin looks and feels, because these are often the very first indicators of metabolic shifts. Have you ever noticed a patch of skin that suddenly looks dirty, but no matter how hard you wash it, it won't go away? If you touch it, it feels thick and velvety. This condition is called acanthosis nigricans. It most commonly appears in the folds of the body, like the back of the neck, the armpits, or the groin. This isn't a hygiene issue. This is a classic warning sign of high insulin levels. When your body develops insulin resistance, meaning your cells stop responding properly to insulin, your pancreas starts pumping out more and more of it to compensate. That excess insulin spills over and triggers skin cells to multiply rapidly, causing these dark, velvety patches. It is your skin screaming that you are on the path toward prediabetes or type 2 diabetes. Now let's consider color. A yellow tint to your skin, paired with the yellowing of the whites of your eyes, is known as jaundice. This happens when a compound called bilirubin builds up in your bloodstream. Bilirubin is a byproduct of old red blood cells, and your liver is supposed to process and filter it out. When your skin turns yellow, it means your liver, gallbladder, or pancreas is struggling, potentially signaling anything from hepatitis and cirrhosis to a blocked bile duct. But yellow can show up differently, too. If you suddenly develop clusters of small, hard yellow bumps that look like tiny pimples, but have a waxy texture, you aren't experiencing a random breakout. These are eruptive xanthomas. They're actually localized deposits of fat. When your triglycerides or cholesterol levels skyrocket to dangerous levels, your body stores the excess fat right in your skin. It's an immediate, urgent warning of severe cardiovascular risk or uncontrolled diabetes. Sometimes your skin acts as the battlefield for an internal war. When your immune system becomes confused and begins attacking your own healthy tissues, a state known as autoimmunity, the skin is frequently the first place the damage becomes visible. Take the butterfly rash, which is clinically referred to as a Maillard rash. This is a distinct, symmetric redness that stretches perfectly across the bridge of the nose and spreads over both cheeks, leaving the rest of the face largely untouched. While it can resemble a mild sunburn, it doesn't fade. This specific pattern is the hallmark signature of lupus, a chronic autoimmune disease that can damage joints, kidneys, and blood vessels if it's left unchecked. What about a rash that feels like an absolute emergency of itchiness? If you develop clusters of tiny, intensely itchy blisters, specifically on your elbows, knees, buttocks, or the back of your scalp, your digestive system might be trying to tell you something. This condition is called dermatitis herpetiformis, and despite the name, it has nothing to do with the herpes virus. Instead, it is the direct skin manifestation of celiac disease. When a person with this condition eats gluten, their immune system launches an attack in the small intestine. That attack releases specific antibodies into the bloodstream, which then travels straight to the skin, binding to the tissue and creating these incredibly uncomfortable blisters. Healing your gut is the only way to heal this rash. Of course, not every warning comes from an internal disease. Sometimes your skin warns you about external invaders you didn't even realize crossed your path. Imagine you've been spending time outdoors, hiking or gardening, and a week later, you notice a small red spot. Over a few days, that spot expands outward, forming a distinct ring with a clear center, resembling a target or a bullseye. This is erythema migrans, the definitive warning sign of Lyme disease, which is transmitted through a tick bite. Spotting this rash early and getting immediate antibiotics can prevent severe chronic neurological and joint complications down the road. But what about the invisible invader we all face? Stress. When you experience chronic emotional or physical stress, your brain signals your adrenal glands to flood your body with cortisol, the stress hormone. Cortisol is highly inflammatory. It physically weakens your skin's protective barrier, impairs its ability to retain moisture, and suppresses your immune defenses. As a result, your skin loses its shield. This is why a stressful week at work or a period of grief can cause sudden, aggressive flare-ups of chronic conditions like psoriasis, eczema, or even deep cystic acne. Your skin is physically manifesting your mental overload, telling you it's time to slow down. While many skin changes point to internal health issues, some warnings are entirely local, yet can be life-threatening. Skin cancer, particularly melanoma, is highly curable if caught early, but it can be deadly if ignored. To read these specific warning signs, dermatologists want you to memorize an easy alphabet, the ABCDE guidelines. You should perform a self-exam once a month, looking closely for these red flags. A stands for asymmetry. If you draw a line right through the middle of a healthy mole, both halves will look identical. A melanoma, or a mole that's a warning sign, will be asymmetrical. The two sides will not match. B stands for border. Normal moles have smooth, distinct, well-defined edges. Problematic spots have borders that are irregular, ragged, notched, or blurred into the surrounding skin. C stands for color. A benign mole is usually a single, uniform shade of brown or tan. If a spot contains a chaotic mix of colors, shades of black, brown, red, pink, white, or even blue, that is a serious warning sign. D stands for diameter. While melanomas can sometimes be small, they're typically larger than 6 millimeters across, which is roughly the size of a standard pencil eraser. And E stands for evolving. This is arguably the most critical warning sign of all. If a mole is actively changing in its size, shape, or color over time, or if it suddenly starts to itch, ooze, crust, or bleed, it demands immediate professional evaluation. Your body is constantly communicating with you. It doesn't keep secrets. It writes its internal struggles directly onto its outer canvas. Persistent dryness that resists all moisturizers might be a vitamin A or zinc deficiency. Painful, cracked corners of your mouth could mean your iron levels have plummeted. An unexplained deep itch could be a sign of a thyroid imbalance. The takeaway here is simple. Stop viewing your skin as an isolated cosmetic issue. When you notice a sudden, persistent change in color, texture, a new rash, or an evolving spot, don't just try to cover it up with makeup or suppress it with over-the-counter creams. Listen to it. Your skin is trying to save your health. If your dashboard is lighting up, make the appointment. Talk to a healthcare professional and find out what is happening underneath the hood. Take care of your skin and let it take care of you.